Hello, everybody. I am Dr. Shruti Manvikar. I am a consultant, reproductive medicine consultant at Ferticare IVF Assist Hyderabad. And today I am really glad to interact with you all through this live session. Here, this I Am Fine, this initiative by Bayer, it has been uh, carved out to achieve a healthier community in our society and also to address a few common problems. Wherein here we are, this will just be a interactive session, and wherein we are going to just guide you with your doubts and other issues. But then for any particular problem, you need to be consulting your doctor there as well. Here, this seeing you all working towards this I Am Fine initiative, this inspires me also to contribute in making your this I Am Fine initiative a better success. And whatever in a way I can contribute, I am very happy to be on this show to contribute towards achieving this healthier society initiative. So today we have been getting quite a few queries about a few doubts on how you are able to achieve a pregnancy, or there have also been queries on any lifestyle changes, how it can affect the pregnancy, or what are the ways in which we can try to get maximum pregnancy when you're trying naturally at home. So these queries have been repeatedly asked by many of you all. So today we have come up with this talk of lifestyle changes which will affect your fertility, and in what way can you plan, and in what changes can you make in your lifestyle so that you get a better pregnancy. We will be talking about that today here. And I would encourage all of you all to keep it an interactive session. If you want to ask anything, please type it in the chat box, and we will answer your queries. So initially I would tell you that becoming pregnant is not very easy for everybody, but there are a few things which if you do in a right way, you will achieve your pregnancy. And not everybody will conceive in the first year of marriage. So only about 60% of couple will achieve pregnancy in the first year of marriage. So we would like to tell you to wait at least for 2 years if your all parameters are normal. Like you have a woman is getting her periods regularly, you do not have any other medical disorders, your routine sexual life is good, and there are you don't have any, you have not undergone any other surgeries, pelvic surgeries, or you do not have any diseases which have been diagnosed before, like thyroid or PCOD or endometriosis or anything like that. If you do not have any of these, you can safely try for a period of 2 years and then try to ask for help. Now, here, to change your lifestyle, the first thing that comes is nutrition. Nutrition, we would tell you, it plays a very important role in achieving a good pregnancy, a successful pregnancy, and a successful baby also. To achieve a pregnancy, you need to have good oocyte and a good sperm. So the nutritional component, when you come to that, it is that folic acid, the folate intake. 400 to 800 microgram per day is the recommended dose for every woman to take 3 months prior to planning your pregnancy. So this achieves helps in giving a good quality oocyte and achieving a good pregnancy. And then there are other nutrients like vitamin D, vitamin A, vitamin C, vitamin E. All this needs to be considered in your diet and your other supplements. 33% of the couple who come for treatment that they've not been able to conceive, 33% of them do not require any major intervention. So, and even the male factor fertility also plays an important role here. So the nutrition is very important to maintain a healthy sperm as well. So men also need to take vitamin D, vitamin E, vitamin A, vitamin C, and then you need to lifestyle changes. You need to cut down on your smoking and drinking, and then you need to do a exercise for about 1 hour a day, and you need to reduce your body weight. Your BMI should be less, it should be adequate, it should not be less, or you should not be overweight. Even being overweight also causes problems in ovulation, you do not get a pregnancy, and being even underweight also is a problem, you do not achieve your fertility as desired. So you need to maintain an optimum BMI and work towards it. Coming to the exercise part, you need to exercise 1 hour a day, both men and women, and cut down on your calories. Carbohydrate should be reduced, and protein intake has to be increased in your diet. Protein intake can be from the vegetable source, plant source, or the animal source. You need to cut down on the meat. Animal source protein doesn't mean you need to consume high amount of meat. That is not recommended. You need to consume uh, egg whites every day. 2 egg whites should be enough. Then walnut you'll need to take lot of paneer, sprouts, vegetables, green leafy vegetables. These are the ones which are most recommended. And then now we also see many people doing very rigorous exercise, vigorously they will be doing to reduce the body weight, or to lose weight and all those things, to bring down the BMI. Once you achieve your optimum BMI, you need to see how much you are exercising. Even vigorous exercise also causes ovulatory dysfunction, and then even that becomes difficult in achieving pregnancy at that time. Here, and then you need to also cut down your alcohol consumption. Red wine can be taken maximum of 60 ml per week is what it has been recommended, so do not overtake that. Also, when it comes to women also can have alcohol, but very much in moderation. We would say if you are planning pregnancy the next 3 months, it is better you stop consuming your alcohol and quit smoking in men and women as well. Then it comes to our other hormonal disorders, what we are commonly seeing these days is because of overweight, obesity, PCO. That is the most common condition what we are coming across when a reason for not achieving a pregnancy. So here, as already been said, you need to reduce at least even a simple loss as low as 5% of your body weight. If you lose, there is an increase in 33% in your chances of you getting pregnant. So that thing has to be taken into account very, very seriously. Yeah, we have a few queries here. Just give us a minute. Yeah, we will take your queries also. Yeah, somebody has asked us that they have a hormone problem. Yeah, that is what we were saying a while ago, Miss. That you need to reduce your weight if you are overweight to overcome these hormone issues, and you need to get yourself tested, get your hormone levels checked, and see where is the problem. There are the fertility hormones, FSH and LH, need to be in the balance. If your LH levels are higher, that means the chances of you ovulating are lesser, and also the so even when you go for the treatment, also the success rate will be less. There is Mr. Rakesh Sharma who's asking us, Doctor, what can be included as protein-rich diet as a vegetarian? Vegetarians, we actually have a lot of options to include in your diet for proteins. A lot of tofu, paneer, and then soya beans, and then soya chunks you can include, and then sprouts, green leafy vegetables, almonds every day. So you have quite a range. Walnuts, many things. As a vegetarian, you can include them in your everyday diet. The Sonia Gupta is asking us, after miscarriage, when we plan again for conceiving. See, it depends on what gestational age your miscarriage has happened. So you also need to know why the miscarriage has happened, because you do not want to get into the same thing again. So do investigate and see why, and you need to make all these lifestyle changes in your this thing to achieve your live pregnancy. And you can plan 2 to 3 months after having a miscarriage, depending on what gestational age your miscarriage has happened. Torch test can be done anytime, but usually it is not much recommended these days. So those in particular test, it depends on if you've been having recurrent abortions. Yeah, it is done as a test, but it has no particular time. You can do it before conceiving. Even some people do it when you're already pregnant. Also, it can be done. So now we were also talking about losing weight and cutting down the alcohol consumption, and also the quitting the smoking part and that thing, all those things. Here also we need to know the lifestyle changes. They play a very important role for us in achieving a pregnancy. You need not Along with these, you need to consult your doctor. If you're not being able to achieve pregnancy in spite of everything you're doing, and still you're not able to get pregnancy in a 2 years time, you please go back and consult your doctor there. Sticky white discharge is compulsory while ovulating. uh, Usually it is a sign of ovulation. Sticky white discharge in the middle of mid period, mid cycle, it is a sign of ovulation. It does not mean that it has to be there for you to become pregnant. Sonia is asking if Sonia, see, if CMV IgG is positive, it means it's an old infection. See, there is IgG and IgM. Okay, so IgM suggests that it is a recent infection. IgG suggests it's an old infection, but then mm, uh, it is not much recommended these days. Yeah, Madhura, good to see you here. Yeah, 6 months and suffered COVID, 2 months pregnant. Any chance of acquiring it again? COVID can come again, but you need to take all the precautions. And these days, it is little less. So try to be safe. Use mask wherever you go. Try to avoid going out if it is not necessary, because you have recently recovered from COVID and you're 6 months pregnant. It is pregnancy and COVID is actually a very difficult thing, very tricky thing. Some people have come out very nicely. Some people have worsened, and many complications have happened. We will not go into all that. We would only tell you to stay safe. There is a chance of you getting it again, but which is very less, of course, which is very less, but you need to take all your precautions. Yeah, Anjali, you have PCO. See, PCOD is a lifestyle disorder, actually speaking. Okay, so you need to do some exercises, do your walking, weights, and then lose some weight. Ovulation induction drugs will have a very good effect if your BMI is normal. If even with being PCOD, many people have conceived with simple letrozole, as you have mentioned here. Yeah, but then with that, you need to go back and see, are you in that normal BMI? Have you been ovulating with a simple small dose of medications? If you do not, in spite of doing all this, then your doctor will try to add other gonadotropins and other things. Eating junk food definitely affects the fertility, because junk food has lot of trans fat, which needs to be avoided by both men and women. Okay, trans fat, they are something which just keeps building your fat in the body, and you become obese with that. Once you become obese, there is a vicious circle of not ovulating and putting on weight and not achieving pregnancy starts, which is very difficult to break. So in the first thing, you need to stop eating all this trans food fats, trans fat foods like chips, all these bakery products, biscuits, and all the maida based products needs to be avoided by you all. That's nice to see you all interacting so well. This makes us keep going more and more with the newer topic or newer, even though this session is about lifestyle changes, many people, you people are asking other things also. We are very happy, something if we are not able to answer to you, definitely we will come back with the next talk on the particular topic of whatever you want. Yeah, when you're trying to achieve pregnancy, yes, you need to take vaccine, COVID vaccine. It has been recommended even by government of India, for everybody now. Even in pregnancy it has been approved. So if you're planning to get pregnant as well, first take your vaccine, because pandemic is there, it is there now. You can wait a month to become pregnant, so kindly take your vaccine. Yes. Yeah, do ask whatever your queries are. We will be very happy to answer everything. We will be very happy to interact, because I don't want to keep lecturing you all about anything. Why recurrent miscarriages happen while patients suffered from PCOD? See, PCOD, as I told you, it comes with a lot of hormonal imbalances. There is a high level of LH. There is a lot of insulin resistance. So, insulin resistance itself will have a, with the oocyte yield, what we get is very less. The quality of oocyte is bad, so the resulting embryo might not be very good. And if you are PCOD, if your insulin resistance is very high, there is a chance that you become diabetic. Already there a tendency of you becoming diabetic is very high because of PCOD. And then the pregnancy and PCOD, there is all the more chance that you become diabetic, and that those things also will lead to miscarriages. And your LH level, when you are planning to conceive, if your LH level has been very high, then there is a chance of the resulting embryo not being very healthy, and there is a chance of you having a miscarriage. Anku, you had a ectopic pregnancy. Other one is okay. Yeah, that's fine. So what do you want to know, Anku? You have ectopic pregnancy. You had two surgeries. One was open, the other one was laparoscopy, right? So you mean to say both your tubes have been removed, or a medical management has been done? See, ectopic pregnancy happens because of the tubal problems. Okay, the fertilized ovum from the tube has to travel back into the uterus and then implant. So, if your tubal factor, if there's a problem with your tubes, the tubal motility is less, or the cilia, the lining inside the tube has been damaged. The embryo which has been formed in your tube, it doesn't travel through the tube to come and implant in the endometrium of the uterus. That is when this results in ectopic. Once ectopic, it means there is 30% chance of you having again an ectopic. But if you have undergone surgeries, as you have mentioned, probably I think you want to say the same thing, that both the tubes have been removed. If that is the case, then you have to go for IVF if both your tubes have been removed. Kashyap, you have already gone through egg retrieval process. You can as well go for embryo transfer. You don't need to wait for the second dose. See, as well, the vaccine has been approved even for pregnant women. So you can go ahead and safely plan your FETs, and then take the next dose whenever it is scheduled. Yeah, the simple brisk walking of 30 to 45 minutes or up to 1 hour, or we say actually 5 to 5 kilometers per day. 5 kilometers a day brisk walking, it definitely helps you in losing weight and maintaining your healthy lifestyle. But along with that, you need to do other things. If you're smoking and drinking, you need to reduce that also. No, Naveed, surgical abortion as such does not affect any pregnancy in future. Unless you have been undergoing repeated surgical abortions wherein your basal layer of endometrium has been damaged, then yeah, definitely there is little difficulty in getting pregnant. Lifestyle. To prevent fertility issues, you need to maintain an optimum BMI, work out every day, at least 5 kilometers a day you walk, or in or 1 hour of exercise in moderation every day you need, and then avoid all the junk foods, trans fat foods, and then all the soft drinks, cold drinks, whatever is there in the market. You need to avoid all that. To preserve your fertility, first you need to take care of all this: your diet, alcohol, smoking, weight. This is when your fertility is preserved, and then you can plan a good pregnancy. Of course, Madhu, you can take COVID vaccine. You are lactating for your 5 months. Yeah, yeah, please do take. You have to take. Priyanka, you have a cyst in the right ovary. Cyst, see cyst. If it is a simple cyst, many of us will come across cysts in our menstrual cycles, and every month the cycles get changed. Because of that, you notice cyst in this cycle, you might not notice a cyst in the next cycle. If your cyst is bigger, so it will be decided by a treating doctor what kind of management they want to do. Either they will go for a medical management, or if it is a recurrent cyst or endometriotic cyst or any other kind other than a simple cyst, it needs to be surgically removed, and then you can plan for pregnancy. So your husband also, if the semen parameters are not fine, if they are not normal, then you need to take the treatment. You need to consult your andrologist, consult your gynecologist, and then plan your pregnancy. Yeah, coming Priyanka has pointed out the right thing, that husband sperm also, there will be male infertility. 30% of the couple who come for treatment for not achieving pregnancy, 30% have been found to have male factor problem. So male factor problem, mainly either it is smoking, drinking, or even in fact some people are teetotalers, they do not have anything, but then there is a high level of stress in them, even in women. No adequate sleep. If you do not sleep for 8 hours a day, the uh, melatonin which is secreted in the body, it does not function properly, and then this leads to ovulatory dysfunction, and then the chances of conceiving will be definitely lesser. So men also do have a lot of oxidative stress in them, which affects the semen parameters. So you need to take a good balanced diet and take some antioxidants, like zinc, selenium, coenzymes, and lot of proteins. This needs to be incorporated in your diet so that you can improve your sperm parameters, and it helps you in achieving your pregnancy well. So painful periods is a very it's totally entirely a different thing actually. So painful periods does not always mean you have some or the other organic problem. You need to do some exercises, some stretching exercises, and some hot water fermentation you can do, and a simple painkillers to try with initially you can do in when you have painful periods. But if it is not subsiding and it is worsening with every cycle, then you need to think that you might have some other problem like endometriosis or some fibroids, and you need to get yourself checked for that. White discharge, if it is not associated with any foul smelling or itching or no all I mean, like, it's simple, it's not curdy white discharge, then you need not worry about that. If these things are there, then definitely there is some amount, there is an infective component which needs to be treated. After Sonia, yeah, after you were COVID positive, now you need to wait for 3 months to take your vaccine. It is very nice to see you all interacting so well, and I hope I am able to answer your queries to the best of my knowledge. Okay, so Shmita, the same query as I've PCOD. You have taken five stimulation, 5 mg 3 months, but you did not conceive. See, taking stimulation of 5 mg and you not conceiving is not the thing. When you are taking a 5 mg tablet, are you ovulating or not is what we see. And not only that, you need to also check your tubal status. You need to check your husband's semen parameters. If you're not ovulating, you need to, your doctor will step up the dose, and whatever or needs to be changed in your treatment protocol, they will definitely change it. Okay, Roshni, you have undergone Roshni, you have undergone treatment for, you have undergone one cycle of IUI and more than 1.5 years of treatment. Okay, see, one cycle of IUI, the chance of you becoming pregnant is 13%. Okay, so one, it is a cumulative IUIs which we do that increases your success rate. So with one IUI, as such there is less chance of conceiving. So I think you need to try another 2 or 3 cycles more if your other parameters are normal. Okay, I think we have been able to cover most of your queries. If anything you want to know you want to ask, you can just drop in a message and we will definitely get back to you. Thank you so much. It was a very nice interactive discussion here. Thank you so much.